Say, we are now joined by Karin Smyth, who's Health Minister. Great to have you on the programme. First of all, we've been talking today about Rachel Reeves' kind of big pitch to MPs last night, basically saying back the budget, it's not a pick and mix. Were you in the room?
I was, yes, I was.
How was that?
It was great. Rachel is on great form, and I think a meeting amongst colleagues, she's very upbeat about that and delivered a message about what we're trying to do with the budget, and cost of living, protecting our public services, getting that debt down, and rallying the troops.
So happy families for now, then, is the message, is it? Well, I do see the details.
They are. I mean, I know there are a lot of interest when people aren't in the room for parliamentary Labour Party gatherings, but I think it's important that she comes, that senior ministers always come and talk to colleagues particularly before big events. It's a regular Monday night event, and it was great to have her.
So you're funding new neighbourhood health centres. This is what you're doing today. What's the idea?
So when we announced our 10-year plan about getting care out of hospitals closer to where people live, we talked about neighbourhood health centres, and these is really the delivery of those centres across the country. The health service is really sort of built services not around people. And at the moment we've got a lot of people that are being bounced around the system, and we want to make sure that that care is closer to home and it's built around them.
What are they?
So they are like one-stop shops, I think is an easy way for people to understand, so that when you go to your GP, that you might have along there more nursing support, more testing, more diagnostics.
So you can go to your GP,
pharmacies.
You don't have to go and get a blood test from your hospital, for example.
Exactly
you can
right.
Just do it there.
Exactly
basically.
right. Have it there in that one-stop shop, building the care and the services around you, particularly frailty, older people, people with diabetes and heart conditions, for example. We know that those people with multiple conditions are struggling, they're travelling unnecessarily, they're having lots and lots of different tests, repeating their stories, all of that, bringing it close to home. Largely based in deprived areas, these new centres, because that's where the need is, and that is a fundamental part of what we're doing to bring down waiting lists.
So the press release says that the centres will be part of a new neighbourhood health service that will provide end-to-end care. And I guess, you know, my question is on hospices, because I just wonder if you can say that at a time when the hospice sector is in crisis. I did an interview last week with Helen Glenister, the Isabel Hospice, and it really stuck with me. You know, she was talking about the kind of services she was having to cut like services like support for children who'd, you know, lost their mums and things like that. And she said that the overnight rise in national insurance added 220,000 to their costs overnight. These are charities, you know, they're not majority funded by taxpayers, as you well know, and it feels like you're just hitting them with this tax rise. Is it something that you'd like Rachel Reeves to look at in the budget? Well,
it is. You know, hospices provide an enormously important service as part of end-of-life care. And when we say we're transferring services out of hospital into the community, basing it around people in primary care, that's what end-to-life and end-to-end care does mean. We don't talk enough about end-of-life care as part of the overall services that the state provides, and that we work with the voluntary and community sector as well. And they are an important part of that. Most people want to die at home. Most people want to die in their community with their family, and most people can do that.
On the hospices, though, do you accept that this is a sector that is struggling? They're having to cut
absolutely
vital services. It kind of feels like, you know, the NHS is relying on hospices to provide this most important service. And then as a government, you're making their work even harder.
Well, we have put in the greatest £100 million capital last year into the hospices in recognition of the work they do. My colleague Steve Kinnock
hit them with this massive tax rise as well, haven't you?
But that funding also went to improve the health service. That is part of some of the choices that were made in the last budget to protect the health service, to get those waiting lists down, to support the overall sector. My colleague Stephen Kinnock is working with the sector. We are looking at palliative care and end-of-life care as part of the overall package, recognising that does need to be better. We are all going to die. That, you know, and recognising that and having that part of the end-of-life care is absolutely what we need to be doing, and they're an important part of that.
Tomorrow, of course, is the budget. One department that it does look like might get a spending rise is the NHS, paid for, of course, by these potentially quite painful tax rises. You know, is all that money just going to go on kind of striking residential doctors?
The Chancellor protected the NHS and our public services in the last budget, and that, as you've outlined, does involve those hard choices. But it is yielding results. Those waiting lists are coming down by over 200,000. We had more GPs put into post Access is improving. It's got a long way to go. We understand that. And part of what this move to more neighbourhood health services to reduce those waiting lists is a fundamental part of that. It is really difficult. The strikes are really difficult. They do knock some of that improvement off course. But those green shoots are there, and I think people are starting to feel that. And staff are starting to feel that. The pressure is huge. We're going into winter. You know, we understand all of those problems.
Yeah.
But reducing that pressure, treating people closer to home, building services around people, not expecting people to fit with the convenience of how services have long-term been organised.
Sounds like a great track record.
But that is what we're doing.
Is your boss Wes Streeton going to end up in number 10 soon as a reward?
Wes Streeton is absolutely focused on driving us all in the health team to do what we're doing, and that is yielding results. We know it's green shoots. We know recovery is going to be long and hard.
According to the Times, he's eyeing up the May elections to make his mood. Sources today, Wes is the best option to bring the party together. He's quids in to win over the soft left. Wes has got the judgment and political appetite to win over the country. What's going on?
I don't know where all that comes from, and I think people get really fed up with it. I do. I know that we're absolutely focused every day on getting down these waiting lists, improving access for GPs. That is our promise to the British people. That is what they expect us to do, and that is what we're going to do.
OK, thank you very much,
Thank you.
Karin Smyth.